So the idea here is we're searching for ashy points around the border of the tibia, and then you'll use as many needles as you need to going through the 3 channels. There's this $1 million protocol for scapular pain that is also for the scapular movement that Dr. Tan created, and is very useful in an area that sometimes acupuncturists have a lot of problems to act over the scapula and the muscles under the scapula. Hi and welcome back to the channel. Today I'm bringing you a case of another athlete. This is another Brazilian Jiu-Jitsu practitioner, and he came to my clinic and he was very worried. Fortunately, it turned out that the problem wasn't as serious as he feared, but he was really scared when he came to me. So for the full story, this is a heavyweight athlete, so a very strong guy, and he came to me telling me that he lost most of the strength on his left arm. He was very worried because he didn't feel any pain, his shoulder was fine. He just said that he lost a lot of power, both while training Jiu-Jitsu or even just when he was training in the gym. He felt like when he was lifting weights, he could easily lift more than 50 kilos with his right arm, and the left arm, he just couldn't lift it. And again, this wasn't pain. It wasn't a restriction on the range of motion, it was just that the power wasn't there. So he was already thinking it was something neurological, something was really wrong with him, and it wasn't just a mechanical problem. I began to analyze the case, and I realized that the most likely culprit for it was some muscle knot or something related to the fascia on the subscapularis muscle. And this is one of the reasons why I defend that it's very important for us acupuncturists, especially if you want to treat athletes, that you have a very good knowledge of human anatomy and physiology, not just acupuncture channels and acupuncture points, but the actual muscles, bones, and tendons that run through the body, because this was what helped the most on the situation. So I told him, well, by what you're describing, I think this has something to do with the mobility of your scapula. And if you remember, if you can come with me here, and if you think about the patient's back, and if you think, well, the scapula is more or less around here, and whenever the arm moves, the scapula needs to move. So the scapula slides alongside the ribs, and the scapula has a bunch of motions that need to happen whenever you're moving your arm, especially in movements of lifting your arm or stretching it like you're pulling. You'll have a bunch of different movements that the scapula needs to make in order for the arm to do the proper movement. So the scapula will have both downward and internal rotations. It will have anterior tilt. So the scapula, depending on the movement on your arm, may have to do something like this rotation, open like this, or even open into this side. So you have a bunch of different movements that you need the scapula to make in order for your arm to move properly. So the first test I did with him was to ask him to take his shirt off and do a few movements with his right arm, and then the same movement with his left arm, and I was observing the way his scapula moved. As you can see here in the video, this is the actual back of our patient. On the right side, you see that the scapular movement is very fluid, so it opens and closes again perfectly. On the left side, you see that it is locked, and then it just jumps into place when the arm forces it to move. This tells us that there is something stopping the scapula from moving properly. Usually it's a muscle knot or muscle tension, or the fascia is not as fluid as it should be, and it's stopping the movement of the scapula. And so to treat him, I decided to use mostly a balanced method approach, which is called the $1 million treatment for scapular problems. And in order to do that, Dr. Tan combines 2 different things. First is using on the opposite side. So here the problem was on his left arm, so I was using his right leg, and we're using between the ankle and more or less the height of splint 6, a little bit above splint 6, and we're using needles on his leg. But the particular thing we want to do in this case is use the 3 yin channels at the same time. So you're threading a needle between spleen and kidney going through the liver also. So we'll end up with something like this, where you see the needle is going all the way through. And if you remember the positions of the channels, we have the spleen channel starting like this and on splint 6 crossing up. We have the liver coming up and then here in the middle, and we have the kidney coming from here, comes together and then moves back. So the idea here is we're searching for ashy points around the border of the tibia, and then you'll use as many needles as you need to going through the 3 channels. This is very good for 2 different reasons. First, we're needling in the area of tendon and muscle very close to the bone, which mimics very well the area of the scapula. Plus, if you think about the image, so if the foot represents the head, the line of the ankle represents the line of the neck, the area of the scapula will be right around here. And using the 3 yin channels of the legs, we'll treat every possible channel that might be affected here. The 2 main channels that might be affected are the bladder and the gallbladder. So the bladder is balanced by the kidney, plus the gallbladder is balanced by the liver. And especially since we're talking about muscle tension and muscle knots, the liver is a very important channel to treat here because it treats tension. But we also have the spleen, which is responsible for the muscles. So we have all the possibilities covered here. So this is done on the opposite side. And on the affected side, so on the left arm, I search for ashy points along the lung channel and the heart channel. Again, just doing a regular balance for bladder and for gallbladder and searching in the same image. So if this is the head and this is the neck, we're searching just below the neck to mimic the area of the scapula. So I did a few points on the leg, maybe 2-3 needles, and 2-3 needles on the arm. He couldn't feel the difference because he could only feel that he lost strength. So he needed to be pushing against something, and with the needles on his arm, it was impossible for us to try it. But by the end of the treatment, we tried the movement again, and the scapular movement was much more even and much more continuous than it was before we did the treatment. And here, after the treatment, as you can see, the scapular movement is not perfect, but you no longer see the jump that you could see before the treatment. So it's much better and much more fluid because we took out most of the tension that was in the muscle that was stopping the scapula from moving properly. And I sent the patient home and booked another session for 3 days after the first one. He came back, he told me that he could feel that in the gym he was stronger. In some more extreme movements and with more extreme weights, he was still feeling that it was not the same as his right arm, but that it was almost perfect. So we repeated the same treatment, exact same approach. So $1 million protocol with the leg on the opposite side and the arm on the same side. And by the end of the treatment, the scapular movement was almost perfect. Again, I sent the patient home, and this time we didn't book another appointment, and that I'd call him in a few days to see how he was feeling, and that's what I did. And after more or less 3 days after the second treatment, I called him, and his feedback was that there was no more difference. So we didn't need to do any more treatments because the problem was solved. And this was the clinical case. As you see, a very simple approach, but what makes this case special, first, is this $1 million protocol for scapular pain that is also for the scapular movement that Dr. Tan created, and is very useful in an area that sometimes acupuncturists have a lot of problems to act over the scapula and the muscles under the scapula. So this is a very good trick for you to have in your book, but Another important thing here is the message that I already gave you in the beginning of the video, which is the importance of knowing anatomy, physiology, how the muscles move, how the bones move, because the knowledge we have from the channels, from the meridians, from the relationships between the Zhang Fu, the 5 elements, that's all very important. I'm not taking anything away from that. In fact, I was using these relationships and the channels to do the treatment. But in order for me to diagnose the problem, I needed to know what the scapula does, what the scapula does during a given movement, and especially if you work a lot with musculoskeletal problems, and especially if you work or if you want to work with athletes, it's mandatory that you study this area, because this will be very important for you, even for you to communicate with, if the athlete is doing physiotherapy, you need to be able to talk with the physiotherapist, and you can tell the physiotherapist, well, I'm focusing on the gallbladder channel, because they're not going to know what that is. And for you to understand what the physiotherapist is doing, if the physiotherapist tells you he's working on a given muscle group, you need to know what it is, what the muscles do. Of course, you don't need to have as deep a knowledge as the physiotherapist does, because that's his thing, but you need to know enough to apply to your acupuncture treatment. That's why our life as acupuncturists is an eternal life of study, because you want to learn Master Zhong so you get better results. You need to learn balanced method. You need to study the classics, but you also need to study the body, the anatomy, modern approaches. So unfortunately, our journey of learning is never done, but it's also a very fulfilling path. So if you really want to be a good acupuncturist, you need to keep studying and focusing on every different area of the body. Thank you so much for watching. If you liked the video, don't forget to like and subscribe to the channel, and share this video with anyone that might benefit from it. And I'll see you in the next one.